So welcome back. In today's video, we're going to be talking about a medication called Fluvoxamine or Luvox. And this is in response to a couple of viewers who requested this medication topic. So without further ado, let's get into it. So, what is Fluvoxamine or Luvox? Well, fluvoxamine is an antidepressant and specifically an SSRI or selective serotonin reuptake inhibitor. So it helps to increase serotonin in our brain. It also has sigma-1 binding properties. And though this sigma-1 binding is not completely understood, what is known about sigma-1 binding is that it can have some anxiolytic effects and can help with psychotic depression. And fluvoxamine comes in immediate release form tablets and controlled release tablets. Which brings us to number 2, what is fluvoxamine used for? Well, fluvoxamine was FDA approved in 1994, and it's approved in the United States for obsessive compulsive disorder and social anxiety disorder. It also has many off-label uses such as generalized anxiety, panic disorder, post-traumatic stress disorder, and major depressive disorder. So how long does fluvoxamine take to work? So just like all the other antidepressants, this isn't a quick fix, and it'll typically take anywhere from 2 to 4 weeks. However, some patients may need up to 8 weeks to see complete results, and this is as long as you're on a therapeutic dose. Now, therapeutic dosing for obsessive compulsive disorder and social anxiety disorder, which has been studied, is between 50 milligrams and 300 milligrams. When you're looking at treating major depressive disorder, it's going to be up to 200 milligrams. So 50 to 200 milligrams is the therapeutic dose for depression. And so that brings us to the next question many people ask, which is fluvoxamine addicting? Well, no, just like all the other antidepressants, this medication is not addicting. And as I discussed in my video on antidepressants and addiction, it actually just causes some neuroadaptation in the brain to occur with long-term use. So if you're taking this medication for 3 months or longer, you're going to want to taper off very slowly to help avoid or at least minimize some of those withdrawal effects. And so the next thing we want to talk about with fluvoxamine are those side effects. And so the most common side effects that you'll get with this medication are going to be nausea, diarrhea, constipation, gastric reflux, somnolence, insomnia, dry mouth, nervousness, dizziness, and weakness. And about 2 to 8% will experience some type of sexual dysfunction, but this is actually seen less in fluvoxamine than with other SSRIs. And now what about those rare but dangerous side effects? Well, first off, there's the black box warning for suicidal ideation, and this typically occurs in ages up to 24 years old. And so therefore, if you're experiencing some suicidal ideation or thoughts, please make sure to discuss this with your provider and know that this is actually an emergency and you should seek treatment right away. Some other rare but dangerous side effects to be aware of are going to be increased risk of bleeding, which actually is common with SSRIs, and serotonin binds to those platelets and decreases platelet aggregation. Seizures are also common because antidepressant medications typically will decrease the seizure threshold, making you more vulnerable to seizures. And also hyponatremia or low sodium count can also be common. So if you're having any lethargy, confusion, muscle cramping, or weakness, make sure to see your doctor and get your blood checked for hyponatremia. Another rare but dangerous side effect to be aware of is that it can actually increase liver enzymes and can lead to hepatic failure. So make sure you're also getting your labs checked to look at those liver enzymes and make sure it's not affecting you in that way. And so that brings us to potential drug interactions with fluvoxamine. And fluvoxamine actually inhibits several cytochrome P450 enzymatic pathways. And these enzymatic pathways are the CYP1A2, the CYP2C9, CYP3A4, and CYP2C19. And because it inhibits all of these different enzymatic pathways, fluvoxamine has a lot of drug interactions. So I'm just going to touch on some of them here in this video, but make sure you do your due diligence and check for drug interactions when you're taking this medication because, like I said, there are many. So with the 1A2 inhibition, you're going to want to make sure that you're reducing your doses or at least monitoring if you're taking medications such as the tricyclics. and specifically clomipirene, because clomipirene can actually be used with fluvoxamine in treatment for obsessive compulsive disorder that is treatment resistant. So that would need to be started very slowly and kept to minimum dosing, since fluvoxamine inhibits clomipirene, and it can also increase the risk for serotonin syndrome with that medication. Theophylline and clozapine are also on the 1A2 substrate, and you'll need to monitor for side effects. And fluvoxamine can actually inhibit caffeine metabolism, so if you're drinking a lot of coffee or if you're a coffee drinker, you may experience more jitteriness or side effects from the caffeine. And contrary to that, smoking is actually an inducer of the 1A substrate, and so if you're a smoker, you can actually induce the metabolism of fluvoxamine, requiring larger dosages of fluvoxamine. However, if you stop smoking and you're still on fluvoxamine, those dosages will have to be reduced. When we're looking at the 3A4 inhibition, some medications to be careful with are going to be carbamazepine, several of the benzodiazepines, those statin drugs, and specifically simvastatin, atorvastatin, and lovastatin. And this can actually increase those side effect risks such as rhabdomyolysis. So definitely make sure to talk to your doctor if you're taking one of those statins and taking fluvoxamine. Some other drug interactions to consider when taking fluvoxamine will include taking tramadol and fluvoxamine can actually increase your seizure risk. NSAIDs, or non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin, can increase your risk for bleeding. And also there have been reports that fluvoxamine can actually displace protein-bound drugs such as warfarin or Coumadin, which can actually affect your bleeding time. So if you're taking that and on fluvoxamine, make sure you're getting your INR taken more regularly. And so what are my final thoughts on fluvoxamine? Well, the one comment was actually talking about fluvoxamine is primarily used for OCD treatment. And what about the uses in other things, such as general anxiety, other anxiety disorders, and even depression? Well, in my experience, yes, I see that fluvoxamine is a very good treatment for OCD, and specifically with the skin picking and hair picking type of compulsive disorders, such as trichotillomania or skin picking disorder. I noticed that fluvoxamine actually treats those very effectively. And yes, it can be used off-label, as I mentioned before, for the treatment of other anxiety disorders and even for depression or major depressive disorder. And there's also benefits noted with fluvoxamine for the mixed depression with anxiety. Now, though it's not FDA approved for major depressive disorder in the United States, it is approved for major depressive disorder in other countries. And here in the US, it's just used off-label and is not used as commonly as the other SSRIs. Reason being is because when they submitted their research to the FDA for approval, it was primarily being researched for OCD. Now there is a lot more research for major depressive disorder and showing its efficacy in treating major depressive disorder, but they just did not resubmit to the FDA to get that approval for major depressive disorder because it's very expensive to go through that process. Now, that being said, they did actually recently submit to the FDA for approval for fluvoxamine because of its anti-inflammatory properties that was noted during the COVID pandemic when patients were given fluvoxamine and other antidepressants like fluoxetine, which I talked about in that video on fluoxetine. And so though we don't completely understand these anti-inflammatory benefits that this medication has and potentially other SSRIs may possess, they did a few studies, submitted it into the FDA for approval for fluvoxamine for treating specifically COVID and other inflammatory diseases. However, it was not approved. And so that just means that they're going to have to go out and get some more robust research and resubmit if they want that FDA approval. Now, when it comes to the cons about fluvoxamine, the reason why it's not prescribed as often as other SSRIs is because it has so many drug interactions. And so if you're a patient that's coming to me and you're having, a lot of symptoms of depression or anxiety, and you're also taking several other medications, this will not be my first choice. Because of all of those drug interactions, there's sure to be some type of interaction with any medications that you take. The other reason is because though it is very effective for the treatment of OCD, it is not often well tolerated. And for most patients, it takes about 2 weeks to get over those initial symptoms and those initial side effects, with one of the most troubling being the nausea and then the sedation that happens with it. And a lot of patients can't tolerate that. They'll say they wake up feeling dizzy with brain fog and just feeling groggy all day. And so it's hard for them to overcome that, and so it leads to them stopping the medication prematurely. And that's why it's not the first choice of many clinicians for treating obsessive compulsive disorder or even depression or other anxiety disorders. So that's it. There you have it. That is my review of fluvoxamine or Luvox. Do you have any experience with taking this medication? If so, please consider sharing it with us down in the comment section below, because we learn from sharing each other's stories. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.